And we are thrilled today to partner with Liftoff through our economic development work led by the Pittsburgh Regional Alliance in the Life Sciences Ecosystem workshops that have happened in this conference. But I'm even more thrilled to have the chance to introduce Amir Dan Rubin today. Amir Dan Rubin serves as chair and CEO and president of One Medical. One Medical is a leading member-based primary care organization transforming healthcare with its human-centered, technology-powered model. Before that, Amir served as executive vice president at United Health Group's Optum division, where he focused on making the health system work better. And before that, he was president and CEO of Stanford Healthcare. But enough about Amir's professional bio. What I do want to share on a personal note is that I have known Amir since our days at University of Michigan Graduate School together, where I had the chance of getting to know he and his wife, who have become lifelong friends of mine. And what I know about Amir is not only does he have an incredible intelligence and wisdom that we all benefit from in his career, but we also know that he has such a wit and a personal warmth. And it is just a wonderful opportunity that we have the chance to get to know Amir today in Pittsburgh. So with that, I'd like to turn it over to my dear friend, Amir Rubin.
Stephanie, thank you so much for that very kind and overly generous introduction. My kids would not agree on the wit of my humor, so at least one of y'all was laughing. So. And what a privilege and pleasure to be here at Liftoff PGH, an incredible initiative and session here today that I'm so proud to be a part of. Well, I'd like to share a little bit here today on how we're thinking about transforming healthcare at One Medical. We've been called a disruptor. I guess I've been called disruptive, maybe in some of those classes with Stephanie years ago, but let me share a little bit about our journey and what we're trying to do. Maybe for starters, just a little bit of definition about what is One Medical. Well, we are what we call a membership-based primary care organization, and we combine seamless digital health with inviting in-person care and testing, convenient to where people work, shop, live, and click. So a little bit about that. We're in our 14th year. I like to joke we're another overnight success, right? This has taken a while. And people signed up originally as a member. You go online and they sign up as a member, and for about $16 a month, they can have unlimited digital health, video chats, messaging, prescription renewals. And then when somebody came into one of our offices, we bill insurance. And that's still the model. Increasingly, though, we've gone to employers who offer this as a benefit to their employees. And we now serve over 7,000 employers. And we have these lovely office visits in convenient locations, same and next day appointments. And all of our providers, they work for us. And they're all on straight salary, whether they're on-demand virtual care or in our offices. And we have, as I said, unlimited on-demand digital health for adults, for children, for family member. I have a rash, I need a prescription, no copay, no deductible, no fee-for-service billings and that. And that's been super attractive. We also have scheduled remote visits. I can have a half an hour in-person or virtual visit with my provider that's billed through my insurance. And then we've integrated behavioral health, medical and behavioral integrated care within a primary care model. The other thing that we've done is we work to coordinate primary and specialty care. So we've created the digital and IT interfaces between One Medical's proprietary technology and leading health systems and provider systems across the United States. So we can avoid duplicative testing. We can collect your information. We can collect your diagnostic lab results from other labs, for example. We can share those with specialists. We could actually help do the referral, the authorization, and in many instances, actually book the appointment on behalf of that patient. And then post, if you will, specialist or hospitalization or surgery, we get that information back so we can manage patients' health and well-being longitudinally. And we also have what we call our Healthy Together COVID care, where we can do testing and screening, and we're now gearing up for COVID vaccination. And we'll talk more about that. And then we've been recognized by many organizations. For example, Forbes recognized us last year as the most consumer-centered healthcare company in the United States. And you see other recognitions here, including a really exciting paper that was just published earlier this year in JAMA, the Journal of the American Medical Association, that showed that our model not only delivers a 90 net promoter score, so really high satisfaction scores, but we were able to take out 45% of the costs for an employer. And we have case studies showing we've taken out 8+% of the cost. This is reducing the cost of care. And we'll talk a little bit more about how we do that. So that's a little bit of background on One Medical and what we're doing, but let me take a step back. What's the problem statement? What are we trying to solve and what's broken in healthcare? Well, a lot of things. We see that the current system is failing multiple key stakeholders. So if you look at consumers, 81% are dissatisfied with their experience. It's hard to know where to go. It's hard to know who to call. It's hard to know how to get answers to your questions. It's hard to get access. What about on nights and on weekends? How about employers? Well, employers are paying for insurance and their health plan payer partners for 180 million people in the United States have commercial insurance. And with that insurance, it still takes 29 days to get access to a family physician. So access to care is difficult. And why did they offer health insurance in the first place if you're an employer? I wanted to recruit, I wanted to retain, and wanted to keep my employees productive. But it's taken a month to get them in. And this year, family health insurance premiums are exceeding $21,000 a year, yet you have this long waits for care. So you have rising premiums in excess of inflation, yet with long waits. So when we look at the demand side of healthcare, if you look at consumers, if you look at employers, if you look at payers, a lot of frustration and dissatisfaction. But you also see problems on the supply side of healthcare. So if we look at providers in the United States, 50% of family physicians, primary care physicians, are showing symptoms of burnout. Now, what is driving this burnout? And the National Academies of Medicine have published studies on this. There's a lot of research done in this. And one of the key drivers of burnout is the way we compensate physicians in the United States. They're paid a fee for service, a fee for every visit. And so what does that encourage? Well, it encourages, if you want to at least optimize your take-home pay, a lot of really short visits. And if there's a lot of issues going on with a patient, a lot of chronic disease issues or follow-up care issues, well, economically, your best thing is to refer all those patients out to specialists. And now back in that employer-payer quadrant, you're like, hey, my employees are now out of work more, running around to specialty appointments, and there's cost and all that. But back in this provider quadrant, it's really frustrating if you went into medicine to try to help people manage their health and well-being, to have really short visits and refer that all out. The other problem we see for providers is what we call the burdens of desktop medicine. Physicians have become very focused, needingly so, in these electronic health records on coding and documentation, and that takes a lot of their time, and it takes time away from dealing with patients. And then they're struggling to manage referrals and authorization and reporting metrics. And then we see various health networks, health systems and plans trying to buy physician practices to coordinate networks of care across primary and specialty settings. So One Medical comes in here and we say we transform healthcare for all these stakeholders simultaneously. So for consumers, we have a 90 net promoter score. So really off the charts member experience. People can get on our app, they can talk to a provider, they can book an appointment, and we have 90th percentile on our quality scores, like the HEDIS metrics that a lot of health plans look at. For employers and payers and consumers, it's same and next day access in our offices. It's virtual care typically within minutes. Synchronous video chats, asynchronous messaging. I have a question, I could do a video chat. I could do another one 10 minutes later, an hour later. One Medical can proactively reach back out to me to see how I'm doing and my child is doing. And consumers and employers on behalf of their employees really love this. We also show that we can save money by having frictionless access to primary care. We show 41% fewer ER visits, and we've shown savings between 8 and 45% on total benefits costs. And I'll come back to that. And then on the supply side, we address the burdens of desktop medicine and the physician burnout by putting all of our providers on a salary model. Even though the insurance world may still pay a fee for service for visits, our providers are on the salary model. It doesn't matter if you want to see them in office, virtually, message them, their pay is going to be the same. And we have longer appointments, half-an-hour appointments. So they have the time to deal with chronic conditions and longitudinal issues, which ends up reducing downstream referrals. And we built our own technology that not only powers our digital health virtual care for the consumer, but actually powers our electronic health record and the work experience for our providers. And we show we're taking 40% of the tasks out for providers that they'd see in other electronic health records or medical groups. So for example, if I message my provider and say, hey, I need a routine prescription renewal, we have a machine learning layer that uses what's called natural language processing that reads that email. And if this is routine, it'll pull that email out of my provider's inbox, if you will, and move it to one of our virtual team members who may respond within minutes to refill my prescription. And then when my provider comes back to her desk or to her computer, she sees 40% of her tasks removed. And then finally, we integrate within health networks. We participate in leading health plan networks, and we've done this clinical and digital integration across primary, specialty, diagnostic, inpatient, acute care. So we can coordinate information, we can facilitate those referrals, we can get that information post-discharge, and we can prevent any readmissions or bounce back in care. So just digging in a little deeper then into this model, it starts with the concept of a member. People sign up for a member, or increasingly employers are sponsoring this for their employees to be a member and their dependents. And we have this fabulous care that is in beautiful offices, very accessible to near where people work and shop. It's same in next day access or where they click. We have this 90 Net Promoter Score. Now, by having this concept of a member, it allows us to do something called population health. We know who our members are, even in a PPO unattributed world where people haven't come into the clinic yet. We know who they are, and we can say, hey, let's reach out to this person. Maybe it's time for a mammogram, or it's time for a pap smear, or it's time to proactively manage somebody's diabetes or congestive heart failure. We can do that in the middle of a current PPO, largely fee-for-service insurance environment. And that allows us to deliver great experience, but also really great quality scores. We're also, in addition to being member-based, technology-powered. As I mentioned, we build our own technology. And this technology is really seamless to use. We have 45% of our members using us every month, right? Who wants to engage with their medical care every month? Well, if you make it frictionless, if you don't charge for it, and you also do outbound population digital health, you get that high engagement. So for example, in these screenshots here, of course, a member can get online and book an appointment and get COVID care and things of that nature. But let's say I came in to see my provider for knee pain. Well, my physician will automatically, and frankly, it's an algorithm, follow up with me and say, hey, Amir, how's your knee pain doing? And if I say better or great, it closes out all the documentation for that physician and nothing needs to be done. And if I say worse, that will come in algorithmically to our virtual team, who will follow up immediately and say, how can we check in with you? We can also push out various other reminders and surveys, like looking at mood or anxiety and depression. The other thing I mentioned is consumers can go online and sign up as members, but increasingly we have 7,000, greater than 7,000 employers offer us as membership. And we have very high retention. 9 out of 10 enterprises renew us. And this is very heavily utilized benefit. When we roll out an employer, 50% of the employees are activating with us when we just roll out. So this is not a 1% to 2%. And as I mentioned, this is a really attractive benefit. We're often told we're the most loved benefit on employee engagement surveys. And employers are paying $21,000 a year for their health premiums and less than $16 a month, and actually discounted off of that for large employers. So it doesn't cost a lot. It's heavily utilized, and we're a great way to engage employees in their health and well-being and help keep them productive and also reduce costs. I mentioned this study in the Journal of the American Medical Association, and what it showed was a 45% reduction in costs for this one employer. And as you see here in the middle, we had 26% reduction in prescription costs, a 33% in emergency room costs, 43 in surgery, and 54 in specialty costs. And really what's the underlying mechanism here is by having frictionless access to primary care, very high service levels. People can come into our models. Our providers are paid on a salary model, so they're not financially incentivized to have a lot of short visits and refer them out. They have the time, and we can do team-based care and population-based care. And this really drives a lot of savings for our members. We're also been very active during this era of COVID, serving not only employers, but municipalities and schools and universities with COVID screening and COVID testing, including in this example, we can have daily check-ins. People can get their COVID test through a drive-through or through an on-site at their employer site or through one of our locations or through home-based testing. And then we can also confer a badge for people if they need to show something to enter the school or the university or the employer site. And as I mentioned before, we're working on our process for COVID-19 vaccination, as we've done with flu vaccines and other areas. Additionally, we serve the entire family. So working parents and families love us because they can get on 24/7 and not only address their health, but the health of their children 24/7 and also in person when needed. And as I mentioned, we integrate behavioral health into medical care. Traditionally, behavioral health is separate from a medical benefit. And you also have this incentive in the traditional world where behavioral health specialists get referred and bill fee for service for sessions, which encourages more sessions. Our model is all of our providers, whether they're our primary care providers or integrated behavioral health specialists, they are on straight salary. And so they can refer across each other. And what we see is a lot of our behavioral health issues can be managed by our primary care providers. They can manage longitudinal issues in behavioral health, anxiety and stress and depression. But we also have group visits that are managed under a medical benefit, remote and in person. We have health coaching sessions where a member can be matched with a health coach. And then we also have therapists on site and remote virtual therapists, and we can coordinate with other benefits. And we see we can handle a lot of behavioral health issues in our model in a lower cost setting without the stigma, without the referrals out to subspecialists and saving a lot of money. And then finally, what are people saying? I can't imagine life before One Medical. That's really quite something. The service overall is amazing. This is one of the best benefits at my employer and has made a significant positive impact on my lifestyle. Or here's another one. The One Medical benefit is so easy to use that it has saved me significant time to be a more productive employee and mother. And from a benefits leader, bringing on One Medical was a no-brainer for us. Employers who aren't already offering this are lagging behind. It was a game changer for us. I love One Medical. So I hope that gives you a flavor of how it is we're transforming care. And just to re-summarize, what we're doing is combining a membership model with our own technology, with salaried providers, fitting in the existing insurance and health system ecosystem, and simultaneously addressing the needs of consumers, employers and payers, providers, and health networks. And by doing this, we've been able to deliver better experience, 90 Net Promoter Scores, better health outcomes, 90th percentile quality scores, greater value, reducing the costs of care of up to 45% as per that JAMA study, and a great team environment, reducing those burdens on our providers and making this a scalable model that can transform healthcare at scale. So I really want to acknowledge and thank the Liftoff PGH team here for putting on an incredible session. Very inspiring what's happening in Pittsburgh. Very inspired myself to be part of this today, and hopefully being a part of transforming healthcare in our country, in Pittsburgh, and elsewhere. So thank you so much, everybody. Happy holidays.